Hey, everybody, this is Barry Mankin here with the Holistic Home Health Podcast. We're here in Nashville, Tennessee, and we're on our two-part of our interview with Dr. Justin Deering. He's with the Deering Clinic here in Cool Springs. Go see him. He's the man. This is our deep dive. So if it wasn't deep enough for you on the last segment, last week, this is going to be even better. So I am learning so much and really enjoying the process. And so hang on for the ride and get your pencils out, okay? Sharpen them up. Justin, thank you so much for being here. And thanks for going to this length and getting this deep with us and really helping us understand this process. So
Sure thing. It's my passion to educate on how we function and how we can maintain resilience. So let's do it.
Wonderful, wonderful. A lot of this is going to be talking about your process of how things work. So we did more of a global look at things on our last segment and just kind of touched down how things happen between the environment, your process, how you deal with people when they first come in, and your interview, and then deciding whether, hey, should I get involved at their house or not while you're treating them. And then we kind of touched on just the high-level aspects of what things could be and how things generally work. So let's get into some of the specifics on the neurological effects of some of these contaminants, again, because we're the filter. And why don't you let me know just because it's a hot topic and we see so much of it, we get into the mold and mycotoxin category. Tell me how this works when somebody has a level of exposure.
Right. So a level of exposure of mycotoxins by function and definition, let's say, the immune system will recognize that it's a problem, but it doesn't recognize it in the same way that it does a virus, or let's think of like a food allergy or something. Food allergies and viruses and bad bacteria, they all have antigens, meaning like a presenting signature, right? This guy wears a T on his hat, right? That's a mycotoxin. They don't have the same type of antigen, and so the immune system recognizes it as a foreign invader. It's a pathogen, but it doesn't quite know how to tag it in the same way that it can a virus, and so therefore you have immune system cells that are out running around the bloodstream looking for these mycotoxins that are kind of vaguely described, from the game of telephone that the immune system plays or whatever. And so they're sitting there, they're aggravating tissues, specifically they're fat-loving, these mycotoxins, meaning they're lipophilic. And every cell wall that we have has a layer of lipid fat in it that makes the cell wall. And we can talk about the vulnerabilities there, but specifically neurons and nerves in general are coated in fat cells, and most of them, or a lot of them, have a myelin sheath around them, especially in the brain. These myelin coatings and all of that will tend to have vulnerabilities to storing toxins that are lipophilic, and so mycotoxins are lipophilic. And so what will happen in that situation is if we have a load that's more than the immune system can handle, that's more than detoxification systems can flush out of the liver, or the lymphatic system of the head being able to pull out of the brain, let's say, if these mycotoxins that have a very teeny tiny footprint, they cross a blood-brain barrier that's there to filter out lots of things that shouldn't be in the brain. And this blood-brain barrier is very vulnerable in lots of scenarios, but in a perfectly healthy blood-brain barrier, what is it? You said 2.5 microns.
Yeah, once we get beyond 2.5 microns, that's kind of like our mold threshold. Anything beyond that, what we're looking for in the environment is to say, okay, anything smaller than that is getting through.
Sure.
And all of our filters that we have. So we're only like a MERV 12, maybe.
Gotcha. Like the air filter.
Right?
So we've got some leakiness, we'll say.
We do.
So we tend to have leaky gut, and leaky gut tends to coincide directly with a leaky blood-brain barrier. So let's say a perfect blood-brain barrier is give or take 1.5 to 3 microns in a perfectly healthy blood-brain barrier if you have these toxins. Of course, it's theoretical and probable, and we can probably define that scientifically, how that happens. But regardless, at the end of the day, if it makes it into this brain tissue, then it's going to lodge itself in the tissue, and it will sit there and aggravate it at very least.
Yeah, and they're beyond 0.1 microns. The toxins, which are the defense mechanisms of these certain molds, like the black mold that everybody talks about, Stachybotrys or Titomium or Fusarium. There's just so many of these, but by the time they're releasing these things, and it's on whatever micron level of that dust, you can, once it gets beyond that, and we're talking about really, really, really tiny stuff. We've only been able to see it in the environment just for the past, 5-6 years. And in our industry, we've only really been measuring it for like 3 or 4, maybe 5. Right. So like this is new for us, where you guys saw it on your end first.
Well, it's amazing that we have the capacity to measure that stuff now.
Fantastic.
And really kind of prove that this connection exists. Because we do see it. My own experience and many other patients that I've seen throughout the years, they had perfectly functioning nervous systems, relatively, prior to whatever injury it was, and when the brain's not able to bounce back, we know that there's a mechanism. So it's going to be in the environment. It's going to be within their own immune system's resilience. It's going to be in their tissue resilience, and so we want to go find where that problem is, whether it's mold or whether it's a concussion brain injury. We want to know what the mechanism is. And so in the case of mold, that mechanism is that it has an affinity for brain tissue, crosses the blood-brain barrier easily, and it will disrupt vulnerable areas. So we can talk about these vulnerable areas because very specifically the most highly metabolic, meaning the most energy demanding, the most oxygen using areas of the brain are going to have the most blood flow, right? And if we have blood flow that's bringing toxins of whatever origin, bad bacteria in the gut, viruses, right, mold, it's going to set up in these vulnerable areas. Well, I measure these vulnerable areas every single day, and we quantify them. We say, how well is it functioning against a normal brain? And we have all of this data. So we can take this and we can get into the weeds here in a bit, I guess, but these highly oxygen utilizing, these highly oxidative areas, we call them, are deep within the kind of filter of the brain. And they are also the areas that are dealing with our brain's connection with our body, our interoception of our gut, and this gut-brain axis. It's communicated there. The awareness of the body and the environment, my vigilance, my attention to my environment is there in the back of this sort of vulnerable network. And it's also the network that houses our consciousness and our ability to direct who's on first. I call it the thinker or the doer, the back of the brain or the front of the brain. And the conductor of that is deep within the brain in this vulnerable network that has a boatload of blood flow. And if we have a bunch of immune activity that's there trying to get rid of a pathogen, then guess what? It's gonna attack things in the neighboring area. The bomb's gonna affect streets far apart from where the assailant is. So it's going to disrupt some neural networks, and it's going to create lasting, inflammation in these networks. And we start to see these problems, occur in mental and mind, capacity and functioning, but also, chronic pain, chronic anxiety, this hypervigilant anxiety, especially when you're talking about like something's wrong in my environment and now I know it and we've tested it.
Yeah, now you're
and
feeding it.
I've got mold in my house and everything's a threat.
Yeah.
Well, it's like that's a big tiger for the nervous system, and our nervous system is designed to avoid threats and get to and build and maintain safety.
Yeah. I get so many people that talk about brain fog. I get so many people that have behavioral issues with their kids or even their spouses, and they aren't getting along in the same way. I really believe that this is at the root of a lot of sociological issues within the family, within society, because we all are stuck with these things. And once we get out of balance with these things, or our toxic load is built up, or we've had long-term exposure to some of these things, and we don't process it, we don't get it out, or it's an acute response, so many of these things I see, these are all my clients, and I would say about 30 to 40% of my clientele, it's growing now because we, are getting known to specialize in this, but are the people that are suffering the most. Sure. But these symptoms are all these symptoms, and to be able to pick apart how this got there, it gives people some hope. The problem with our industry with this is that by the time sometimes they get to us or they get to you, they're exhausted.
Sure.
Because the pain points have either been they've gone in through the tension in this industry or through the tension of this industry and bounced around between misdiagnosed or not, only got 10% of it, or it made it a little bit better but not enough, or made it worse, or it comes back. I mean, until we really get a holistic look and just stay with a process to be able to see through all the way to the finish line. If they don't trust that process, in a lot of cases, they're right back on the horse, and these things either come back worse or they just come back, in the way they were, and they just get fatigued and financially fatigued. Sure. Through this process, because insurance isn't taking care of any of this stuff, which is a shame. So, RFKJ, for you, let's fix this, okay? So, with that said, I was wondering about that when you were talking about the soft tissue and how that really affects these most vulnerable areas. I'm always thinking inhalation. I'm not taking consideration what's being delivered from the gut after the body has a toxic load from other places and also affecting the brain, which is really interesting. So those pain points are, they're a big deal for the clients. It's the reason why they call us in the first place. And so for us to be able to give them to somebody to say, hey, you need to start a process. Right. Trust the process. Sure.
It's one of those things where you realize that something's wrong with your home, and that's a big, huge component of what can stress somebody out significantly. But it also starts a process of, we have to fix it. That's depending on how big the issue is. It could be a small problem, big problem, and that's small cost or big, huge cost. But at the end of the day, you've got to remove the source of the thing that's making you sick, right? And oftentimes you remove the source, like in scenarios that I've always heard about with patients that come to me and tell me their story from the past, and we got rid of mold and I've automatically began feeling better and functioning better and all of that. And then I have folks that say, I was in this moldy house and this thing started with me neurologically. We got the mold fixed. It's all good, but I still have these major problems that come about every time I have a major stressor combined with an immune stressor. It will go back and aggravate the same sort of pathways in my brain. And anyway, those people know what's happening at that point in time if they've had that kind of experience over the long term. But when it comes to the burden of it all, it can be very stressful in and of itself. Even if you didn't have the inflammation in the nervous system, this big, huge immune response, and everything else was fine, it's still just stressful having to do all the things that we need to do to remediate and do all the things that we might need to do health-wise to recover that health. So, it's totally understandable. Yes, I wish homeowners insurance would cover it.
Yeah, right.
Or actual health insurance would cover investigative processes like this and help people to restore their health, as opposed to just dealing with long-term problems from disease, which is what insurance is made to do. Or in the case of the home, unless you have a pipe burst and it floods the whole house and you catch it within 2 or 3 days, then it's not going to be covered.
Correct. Correct.
If you have a little overflow from your washer, like I did in the house, and I called you out and said, hey, I don't know how long this has been here. I need to figure out, what is potentially growing.
Yeah.
Insurance isn't going to cover a claim like that because it cost me a few grand to rip out a wall and put a new one in, and we made sure that we made sure that things weren't growing elsewhere, and so we were pretty confident that we're good to just kind of replace it and put it back.
Remediation process. Yep, absolutely.
So there's a lot to it.
Tell me about other types of issues related to different diagnosis from other people, where somebody says, hey, I have this pus diagnosis or mast cell activation. Right. Tell me what those are and how those manifest themselves.
Sure. So let's say these are all immune-based things. So we can have multiple layers that stack up over time. Just like we said, you might have exposure in a home that's mild, but then it's the 3 or 4 other things that end up tipping the immune system overboard. So whether it's mold, whether it's Epstein-Barr virus reactivation that's more commonly known these days, or histamine gene types.
Is that pandas as well, or is that a different thing?
Pandas is a little bit different thing. It's an childhood autoimmunity that affects the brain for sure. But these scenarios often end up causing autonomic problems. People are dizzy in a different way than you were. They're lightheaded. They have a hard time standing up without feeling like they're going to pass out, or they have tachycardic syndrome, and that's what a POTS diagnosis would be, is a postural orthostatic tachycardic syndrome. And that's very common in these immune dysregulated patients. And it's certainly happening because the brain isn't firing and connecting in the way that it needs to these reflexes that pump blood flow to my head when I go from this chair to stand up. I need a very fast, quick reflex. And if you have a long-term immune challenge, or even a short-term significant immune challenge, then you will have this increased immune response on particular nerve types, autonomic nervous system, that will release histamines in these mast cells, or mast cell activation syndrome. These histamines will be released as a protective mechanism, sort of like inflammation. It's there to dilate blood vessels and flush things out and all of that. But if this histamine response is too overactive, then it's going to end up causing chronic, aggravation. And we have certain bacteria in the gut that kind of fuel this histamine response. We have histamine-type foods that will fuel this overactive histamine response, and people end up dizzy and headaches and chronic fatigue and of course migraines, and these worst-case scenarios being POTS and MCAS, this mast cell activation syndrome, can create this big systemic effect, and people have major problems from it. So there's a lot of overlap in this immune system and the nervous system. And so if we have things like an Epstein-Barr virus, let's say COVID really highlighted our understanding of this neuroimmune connection because people were inundated with a new virus, and it spread the immune system thin, to put it generally. And it had to go make a bunch of novel or new antibodies. And it was just kind of trying them out on this new virus spike protein, which is the antigen. And it was trying to do that. And during that time, the immune system and the nervous system got spread thin. And so things that we carry since our childhood, things like an Epstein-Barr virus, which is mono, we can think of it kind of like shingles. We have chickenpox when we're a kid. We're going to get shingles when we're an adult if we have stress, immune challenges, and hormone shifts. That's when shingles comes out in older individuals. But anyway, same story is that with Epstein-Barr, it gets lodged in a particular ganglia, a different one than shingles. And this Epstein-Barr will find a way to reactivate itself in this time where the immune system spread thin. And that will cause the immune system to further try to go attack this thing. And now the troops are just spread too thin. And so we have this ongoing kind of long-term chronic viral reactivation. This is one big, humongous cause and reason for long COVID type syndromes. And we see a lot of it in our clinic. People who've had, burning faces and tongues for 5 years. It goes beyond losing your smell and taste.
Right. Yeah, exactly.
But, and a lot of them find that they also have this thing. They might have went down the idea of maybe it's mold that's causing some of these things. It's aggravating my long COVID, and it absolutely would aggravate, a long COVID type syndrome.
Yeah.
So there's things that we have a great understanding of, and there's a lot of minute details that we're not exactly sure which, donkey to pin the tail on always, but that's part of the investigative process.
Yeah, this goes back to that silver bullet thing that everybody wants, right?
Yeah.
Because, and this is why everybody pins everything on mold all the time, because it may be a factor, but why is it a factor, and how much of a percentage? It's that balance between the vulnerabilities of the inhabitants and the health of the inhabitants versus the vulnerabilities and the health of the home. Right. And those multiple things can be true at the same time.
Sure.
Right. But when the hot topic is always mold, as much as that's, we do a lot of that stuff. But there's other factors in the house, just like there's other factors in the body. And really, and I don't think people think in as far as like having their paradigm shifted to a broader scope of looking at these specifics, because there's so many unknowns. And so this is just a great information to say, this is really how everything works, guys. Right. And in the house, we're going to say the same kind of things and say, hey, it's not just, there's mold, but is it the mold or is it you? What's the percentage of this versus the percentage of this? Right. And it takes both. It takes that holistic end on both ends to say, hey, let's make sure your main exposure is healthy. Right. And how healthy do you need it to be? Do you need a bubble? Right. We can definitely do that. Right. But
you can do that. Yeah. And be functional anyway.
Yeah.
It's not healthy to not be exposed to, all environmental scenarios.
Yeah.
You certainly don't need to be constantly exposed to a super toxic one.
Correct.
With the worst molds. But, you remove the source in this situation.
Right.
And the individual is not exposed as much. But, do the symptoms totally go away? I've seen people remediate their house 3 and 4 times.
Oh, yeah.
Because it has to be the mold.
Right.
So,
they bankrupt themselves. They get stressed out. And whether it's done right or not, that's another thing. So, and that's really the quality control of what we try to handle. And the other end is to say, again, what are the vulnerabilities of them? What are the things that are triggering? Because mold is just one trigger of that body.
So no matter what walks through our door, the goal is to say, well, whatever we're going to find in this environmental thing, let's say I look at a stool test and we've got some terrible bacteria in there. Well, it's an environmental thing. It's what you're putting in and what's being maintained in this ecosystem of the gut. Or you're breathing in mold, whatever. It's the environment. Well, while we're addressing the environmental piece, the focus long-term should be, can we rebuild and maintain your resilience as much as we possibly can to where you could walk back in that moldy house, a year from now, because you were gone on vacation for 3 weeks and you had pipes burst and there's mold regrowing, whatever worst case scenario. Yeah. Can you walk back in there and stay for a day or two without, falling apart?
Yeah.
We want to have some level of resilience, and we want the largest level of resilience that we can have. And,
sure, absolutely.
And so we need to, just address all of those pieces and try to understand that there's multiple layers to how our immune system works.
So let's talk about the regenerative side and some of those steps that you would do for somebody that is in whatever contaminant it is.
Sure.
Obviously, build up the resilience, is in different ways that you would do that. But what does that look like?
Right. So evaluating environment. Very often I'm evaluating the internal environment. Of course, you can measure lots of different things, but we look at the environment. We say, what can we do to improve the production of the things that make you healthy in the gut? We're also going to begin addressing any areas of detoxification vulnerability. Do we need to move inflammation? Most people who have problems, yes, we do. So we start to do that with diet and herbs and supplementation and some of those things. And while we're starting that process, we go about addressing the functional things that we measure that aren't working as well as they should. So in order to get to a place of being able to totally go about regenerative medicine, which is revamping their cellular function on the highest level. You can do that in a number of ways, but regenerative therapies are generally thought of as things that create a change in cellular senescence. So like cells that die, we need to be able to get rid of them. Cells that aren't functioning as well as they need to, we need to be able to recycle them through a process of autophagy and all of the different mechanisms. And we can employ a number of things. Let's say hyperbaric oxygen is one of those tools that creates this resilience over time through that process. You can utilize ozone therapy. You can utilize exosomes. You can utilize NAD plus is known as a cellular senescent therapy.
That's a big hot topic right now. Yeah.
And so there are quite a few other ones, peptides. There are many peptides that will contribute to that. So our medical team kind of handles that aspect of prescribing based on the patient's individual symptoms. And on my side of things, we are working on the gut and the immune system as well as the nervous system. And we do all of that through measuring everything that we can measure and then employing tools and techniques to get them to a place where they've detoxified well enough so that we can apply some of those heavier hitting regenerating therapies like oxygen and peptides and all of that will help the cells come back to an ideal balance and ideal resilience. So that's the idea of regenerative medicine, is that we can help the body do its thing so that it can heal itself better, faster, and deeper.
I love the whole concept of getting the body in line to where everything's functioning as it should so that it heals itself. When I first met you, you were the guy that told me to say, yeah, there's maintenance, but ideally you shouldn't have to see me again if I do my job, right? Unless there's another problem and you stay healthy, right? And so, but most people need some level of maintenance and some level of care. I've had long-term abuses with just construction, and we've done some other therapies and that have helped me quite a bit and allow me to function. But to have all those different modalities and to use them to be able to keep people or get people back in shape for the body to maintain itself should always be the goal of medicine.
It is.
Right?
Should.
So not always is, but should be. All right. So let's talk lastly about preventative.
Yes. So when we're talking about prevention, we need to make sure that we have a rock solid gut. If our gut microbiome is our internal environment, it makes a bunch of things for us that we need for maintenance of brain integrity. And then, of course, we need exercise. We need to eat right. Yeah. We need to sleep well. Yeah. We need a good rhythm in the day, wake at a certain time and go to sleep at a certain time. And ideally it's, with the rhythms of the sunrise and the sunset. Yep. It really should be simple. And of course, modern life kind of complicates all of that. Stress. And so that is prevention, maintaining the rhythm that we were made to maintain. And one of the biggest components of what modern life does to our rhythms, one of the biggest areas is gut problems and inflammation, environmental things. Toxic water, toxic air, outside. Yeah. I'm not even talking about mold. Sources. All the stuff. Inside, you can have radon gas. You can have all of those different components that affect the way our internal body chemistry functions. So can we maintain our internal body chemistry in an ideal state? Well, it takes us really working on the gut and the cells and the blood vessels and brain tissue to make sure that things are as resilient as possible. So prevention is a set of activities that aligns with what humans have always done, which is to eat well, sleep well, move well, all of these different components. And so there's very specific things that we can do on the gut side of things to optimize it. But really it's making your neurotransmitters, it's making very important molecules like short chain fatty acids that help you to maintain your gut lining. And they also signal to the liver and the rest of the signaling system to tell the brain to go into the anti-inflammatory state of the microglial activation. So in the first episode, we talked about M1 versus M2 microglial activation,
Mm-hmm.
and it's short-chain fatty acids that play a tremendous role in taking an M1 state of glial activation back to an M2 anti-inflammatory state, so that we can reduce neuroinflammation and we can increase neurogenesis and neuroplasticity. So if we can maintain a decent and abundant gut environment with all the good microbes that should be there, all the bad microbes need to be kept in check by the good microbes. If one of those bad microbes pops up and starts to put endotoxins, like we talk about a mycotoxin.
Yep.
Well, a certain type of gram-negative bacteria will put off a lipopolysaccharide. That's an endotoxin, and that is very aggravating for the brain.
Yep.
And if you got all of that happening, plus you get into a moldy environment, well, guess what? You brought two pieces together that's not good.
Yeah. And then they're fighting
for the brain and the nervous system.
Yeah, because all the you got the molds in there. They're putting out the toxins. Hey, there's bacteria out there. Like, I'm going to fight you. Well, it's just like one of those kung fu movies where you get the delayed reaction with the movements.
I would love to see a scientific microscopic depiction of how that happens.
That'd be awesome.
Between the toxin and the bacteria. Please.
I think we should.
Help me generate one.
Maybe
of those.
we ought to, I don't know, get like a cartoon done with that or something. That'd be awesome.
That'd be fun.
Oh, man, that's funny.
Yeah.
All right. Well, I'm blown away. Yeah. Thank you.
Absolutely.
This is so rich. I really think the more this type of dialogue that we have, the more education that we put out there for the public, people are going to start thinking differently about prevention and how they approach their health. And traditionally, there's been so many, good aspects, but also bad aspects of how things have been done since medicine really was being instituted, especially in the West here. And for us to be able to have it's almost like we have a new age of medicine that is that has so much science to back up the philosophy. Right. And it's just really going to be about how we put these things together, and then the order that we start to do these pathways through to get to health quicker.
Right.
And to me, it's a lot of it has to do with about this bridge. Okay. And I just appreciate your passion for what you're doing, and your curiosity for it, because you keep learning. Like every time I come by there, you got your nose in a book. Hey, did you hear about this? Or and we're both like nerding out on the latest things going on. So and we're going to keep doing it.
Absolutely.
You know what?
There's going to be more to learn, and this
always is.
This bridge is going to be built and fortified because
That's right.
In this era in the last 5 years, people understand that there's more to maintenance and resilience of their own health and taking it into their own hands than just waiting until something falls apart to go try to cover it up. And
it's a human condition. Yeah. We always so be preventative, kids. Okay, just like it's so much better, it's so much easier.
Yeah, understand your body and your brain and
make good choices.
Yeah, right. Easy to say.
That's right. Yeah. Well, thank you for watching, guys. Hope you enjoyed it. And Justin, thank you.
Hey, thank you
so much. The Deering Clinic, Cool Springs, Tennessee. All right, check him out. He is top notch, the top guy in town. Neurological, you name it, all across the board there holistically. So let's do better. All right, let's continue to fight the good fight, and you guys be careful out there. All right, thank you.